Okay, this is part two. This is on the housekeeping. A lot of injuries with housekeeping related tasks. As you can see with this graphic, a lot of stuff with the shoulder impingement kind of stuff, i.e., rotator cuff kind of injuries. A lot of overhead stuff leads to rotator cuff injuries, TOS kind of stuff. A lot of hand and wrist kind of stuff, carpal tunnel, probably tennis elbow kind of stuff, golfer's elbow kind of stuff, Parnato-Terry syndrome, all that sort of stuff. Back injuries are big ones. I think this graphic is a good example of why the upper extremity and the work classes blur together. You can't really separate them. A lot of the upper extremity injuries are due to ergonomic issues. A lot of ergonomic issues cause upper extremity problems. So we have to kind of look at it as it really is in the real world. I know it's hard to get it as a student because it's blurring in your head and stuff, but really they go together and you have to learn them together because that's how you're going to see it out in the clinic in reality. This is another good graphic, shows you how hard housekeeping can be on your body. All these jobs are really hard on the body, but housekeeping really seems to be the most in terms of cumulative trauma injuries. Those are usually like repetitive motion kind of injuries. We're going to really getting into that in upper extremity in the next few weeks, I think, coming right up. But it's like 3 times as much as waitresses, and they have a lot of problems. Almost twice as much as cooks, and a third more than dishwashers. So it's a lot of injuries with housekeeping. What are the things that are causing all these injuries for housekeepers? Like I said, just the reaching overhead, repetitive motions overhead, really hard on the shoulders, because we know the shoulder joint, highly mobile joint, which makes it highly vulnerable to injury. So if you're reaching overhead, scrubbing, wiping, cleaning windows, whatever, it's going to catch up to you over time. Dusting, vacuuming, talked about vacuuming, can be very hard on the body, especially a lot of these heavyweight ones that they're using industrially. Awkward positioning, reaching into awkward places to try to clean bathrooms, that sort of stuff. Getting down on your all hands and knees to wash floors. Making a bed. Making a bed can really be hard on your back. Can't tell me any clients I've worked with, problems around making the bed. The carts, you think of the carts that they're using in these big hotels and motels, pushing those carts around can be an issue. Okay, breaking it down in particular, the mopping is another big one for custodial services, housekeeping. The guys that do Hassan, you see them doing a lot of mopping, that can be very hard on your body. These are some tools and tips. There's also a box on these, a treatment box on tools and tips for housekeeping. Much like the upper extremity, you need to know all those boxes for the final exam because you're going to get a case which would involve at least one of those boxes. So the mopping and sweeping, tips to help it to work on that, moving kind of side to side, avoid those extreme reaches, alternate arms. Microfiber can be easier, glides easier versus those string fibers that just drag on the floor. Using mop rigger, body mechanics, keeping body back straight. Other things, avoiding lifting mop bucket full of water, pouring in a sink, using a hose or a floor drain, so you have to don't have to keep hauling it back and forth to the sink and killing your back. Use a mop bucket with hook to easily tip. You have these ergonomic handles that may be the ticket for somebody to try this out. Easier to kind of turn and glide, easier strain on the wrists. Clean the restrooms, other services can be really hard. The awkward reaching, and you think it's not just doing this once, it's doing this, 8 hours a day. Really can end up beating up your body. Simple things such as long-handled extensions on the mops and dusters and dust sweepers can make a big difference. Knee pads can make a big difference. Ergonomically designed handles can make a big difference. Building it up, different curves, whatever it seems to work to get that wrist in neutral and thinking power zone versus danger zone kind of stuff. Carts, moving carts with cleaning supplies. Use carts whenever possible. Carry only small quantities. Try not to carry things a lot. Carts should be pushed, not pulled. The wheels, keep the wheels working so they're not dragging, especially on those carpets. The right height, whether the right height for the person. Push them with 2 hands. Keep our arms close to you when reaching for supplies. A lot of this kind of common sense stuff. Kind of remember how to do this. Kind of basic OT kind of stuff. The vacuuming, this is cool. These backpack vacuums take a lot of the load off. These robo vacuums, that's what you've seen. Do it automatically, robot vacuums. Alternating arms, lightweight vacuums, low noise, anti-vibration gloves, maybe the deal, larger wheels. That body mechanics we've talked about, putting it on your hip like I was showing you. Backpacks, robotics, ergo handles again. Bed making, a lot of it's just kind of really thinking super conscious of your back. It's really hard to do without some bending of your back, but obviously this over this, bending your knees, trying to keep your back straight as much as you can. Certain tools, this Tucker thing, bed lifting wedge can make it easy to get those sheets tucked under. That's what kills people, a lot of tucking the sheets, bending these awkward positions, tucking the sheets. The Zip It, it's like more like a sleeping bag kind of bed. You can look at the video about that. 2 people working together, ideally for making a bed, especially if you're doing this all day long. Removing the trash, that can be a big thing. Awkward positioning, awkward lifting, body mechanics, less weight, multiple trips, a second person, power zone, or these mechanical lifting devices. Okay, so that's some tips around housekeeping, and that's